All right. So we are going to talk about chapter 24, complications of aging. Um, and so geriatrics in general as a practice, the older population, it seems simple, but they can be very complicated. So they actually disease progresses differently, medications can act differently in the older population. So it's kind of in the same spectrum as children where things can be pretty different. So um, basically, uh, there's a word they kind of highlight here at the beginning of the chapter is sensens or sensonance. Ugh, such a weird word. Sensonance. See, I can't even say it. So, there's gonna be plenty of words that are hard to spell and say. But if you see the sensonance word, basically what it's talking about is just that period of old age or period of life from old age to death. So the biological period of life from old age to death is incidence. So this is just describing the process of aging. Um, it's kind of a cause of our death, and this is just the onset of where we consider as old age to death. And so this is where geriatrics and geriology kind of comes into play. Just a pre-question here. I'm trying to read a question. What do you think would be the most vulnerable tissue to aging due to the inability to regenerate effectively? So let's see. I'm just going to see what your A&P knowledge is to see if you can figure this out from the options here. So I'll give you a second to pause the video. Okay, ready for the correct answer? It is our central nervous system. Our central nervous system neurons tend to be long life cells that don't regenerate or heal very well, and so the older we get, the more at risk and vulnerable this type of tissue is. So the aging process, the rate of aging is going to vary among individuals. Sometimes people age like a fine wine, and their age doesn't necessarily match their chronological age. It depends on a lot of stuff: their genetics from their parents, lifestyle choices, overall health, and definitely it depends on cardiovascular fitness. Typically, people that are older that have more cardiovascular fitness, more active, uh, tend to have a better process with aging. So overall, women live longer than men. The rate of women. There's a reason for that. Men are silly. So women live longer than men. There's just a general function that occurs throughout the process, and some of the most vulnerable tissues are central nervous system, skeletal, especially I would say cardiac muscle, central nervous system, and our kidneys. So your big three of the most vulnerable tissues: CNS, cardiac muscle, and kidneys, for sure, are going to be affected in the aging process, or the most at risk to be affected. There's going to be some hormonal changes. So most of the time, hormonal levels will stay the same, uh, except for women and men. Definitely the hormonal levels of estrogen for women and testosterone for men can fluctuate, but most other hormone levels stay relatively the same. Um, One thing that does come up sometimes is the number of tissue receptors for hormones does decrease. So, especially like that's why diabetes type 2 can be more prone in the older population. The receptor for insulin and moving glucose out of the bloodstream, those receptors numbers decrease, thus more likely to suffer from high levels of glucose in the bloodstream. And usually the speed overall of the hormonal system, of the endocrine system especially, is somewhat diminished. So just reviewing what I just asked, what happens to the number of tissue receptors for hormones as one ages? Again, see if you're paying attention. What's the answer here? Okay. Yep. It's tissue receptors decrease. That's correct answer number two. Another question. Let's see what you think you know ahead of time here. Again, another kind of pre-question, see if you guys have read the chapter or you can kind of guess from your experience. What happens to the lens of our eye as a person ages? Here's your options here. All right. Correct answer is it becomes less flexible and typically more not clear, it becomes more opaque and cloudy and less flexible, therefore letting less light in. This is kind of what leads to things like cataracts. How does aging affect the immune system? Again, trying to see what you think about this. I'll let you pause the video. Correct answer is yes, the decline of production of T and B cells, which are a big part of our specific immunity system. So our antibodies production and overall immune system production, T and B cells are the very specific agents that fight that. A lot of questions in this one. I like a lot of questions. Sometimes it's good. What's a common effect of aging on taste and smell? Again, just trying to preemptively see what you know. All right. Correct answer is taste and smell sensation is very diminished. Therefore, older populations suffer from anorexia or just loss of appetite in general because food doesn't smell as good, doesn't taste as good. Sometimes swallowing is affected because of the muscles of the epiglottis, and so swallowing becomes more of a task, and so all those factors lead to um, ineffective nutrition in the older population. So just as we piggybacking off those kind of preemptive questions, vision, the lens can become less flexible. This is going to mess with vision and the ability to accommodate. And it also becomes more opaque, yellow, less transparent. This is where cataracts can develop. Also, this means that the less light gets to our retina in the back of the eye. Therefore, night vision is affected. Color vision could be reduced. And vascular degeneration of the may affect the retina. So less vascular flow to the retina means less receptors for photoreceptors, means less signal gets to the brain about vision. Other sensations, usually hearing loss. This is just degenerative changes in the inner ear, less flexible components of the bones and other components of the ear. Sense of taste and smell are diminished. And diminished taste and smell again, impaired appetite, impaired nutrition, those sort of things. Think that. Other things, again, infections, there's delayed rate of cell division, there's delayed healing because of that, but also there's delayed immune response because the T and B cell production is less, so more risk for infections. Cancer, just years of exposure to carcinogens. Again, carcinogens or any kind of chemical or material that might potentially cause cancer, and autoimmune disorders just because the immune system has a potential to change. So again, immune system decline, reduction in production of T and B cells, decreased effectiveness of mature lymphocytes, maturing of their immune cells. This leads to just a general inability to fight infections. And then because the skin or other cells and undergo mitosis more slowly, it's slower wound healing, may develop ulcers, skin infections, those kind of things. And there's multiple disorders that can be common in older population. And for older population, definitely changes in one of their body systems seems to affect the other body systems because of the general decrease in functionality. Large number of prescription medications, very common, and also just over the counter. And this is just basically increases the risk for undesirable drug interactions. Compliance definitely is a problem, meaning they forget to take them or just not good at a regimen of taking their medications. And there's a lot of dosing adjusting that can be, and for the older population, because of these decreases in their cellular metabolism, their immune system, and overall a lot of other stuff, especially with their kidneys, is delayed elimination of drugs or weird or improper, unpredictable absorption of drugs. And so that can cause a lot of effects. I've had it the case where you've had the older population has confusion and aggression, and you may give them anti-anxiety medicine, something like lorazepam or something, Ativan, something that's supposed to, help kind of relax people and take the edge off. For older patients, sometimes it can have the opposite effect, make them more hyper aware and more aggressive. I've seen that. So those kind of opposite or unexpected absorption and distribution of medications has been noted in the older population, and it can be unpredictable. So, what would be a significant risk associated with multiple medications in older adults? If you had these options, what do you think? We just talked about. All right. Correct answer is increased risk of undesirable drug interactions or undesirable drug effects, basically. Which is following is a common issue with skin in older adults. Again, that goes to skin breakdown and ulcers, which could lead to infection. Again, that goes back to just general decrease in cellular metabolism, general decrease in the immune system. Another question. We're just going through a lot of questions on this one. What's a significant factor contributing to cancer risk in older adults? Okay, if you pause the video, come up with your answer. And correct answer number two. Again, you think that we're all going to be exposed to some types of carcinogens in our lifetime. The older we are, that means the more potential carcinogens we've been exposed to in our lifetime. So, what's a common characteristic of multiple disorders in an older adult? I'll let you pause and answer this. This one's pretty straightforward. Number four, integrated treatment for all interacting problems. So the older adult has to be taken into consideration all of their disorders. We can't just treat them on an island. We got to think about everything and how it's going to affect the other. And finally, what is a common issue with medication in older adults? So again, I talked about this very briefly. And the answer is compliance. Again, just forgetfulness or disorganization or too many meds to keep up with. I do think that we're treating way too many older adults with medications. But so moving forward. So next we're going to move into chapter 25, which talks about immobility and associated problems. A little short romp through chapter 25 here. But basically, this is talking about what's going to happen if people are immobile, not moving. And I think some of the risks are pretty obvious, but there's some things to talk about here. Um, so, immobility, as far as some terminology, um, hemiplegia is a paralysis or a numbness in unable to function or move on own an extremity on one side or multiple extremities on one side of the body. So this is common with stroke patients. If they have a stroke that causes issues with a certain part of their brain, it could lead to localized numbness called hemiplegia or decreased functionality on their right side per se, and they have to walk with a cane after having a stroke. That'd be hemiplegia. Paraplegia is paralysis of the lower body half, the legs. Quadriplegia, so para is like a pair of, so two. Quadriplegia, quad is four. Quadrant, quadruplets. That's four. So paralysis of usually their trunk, torso, and then all four limbs. And diplegia is symmetrical paralysis in an area of the body. So diplegia can happen in like a very specific area from like a traumatic injury or something like that. You could categorically say diplegia would be even just like a numbness area for like a scar or something like that, but it's just more localized, specific area of the body. But the thing to think about with all of these and immobility is just when the body is especially supine, lying on your back, the loss of function uh, basically is going to gravitational force doesn't change, right? We're on the earth and gravity still exists no matter if we're laying down, standing up, on top of our head. So the gravitational forces of the earth are going to affect many of the body's functions. So think of everything kind of slowing down. And just give you the insight for this whole chapter is some of the biggest problems with people with immobility is related to that slowing down of kind of everything, especially our intestines and our urinary tract. So if there's your hint for the kind of whole chapter is the big of issues of immobility. There are others we're about to talk about, but is primarily intestines and urinary tract and then skin. Those are kind of your big three you're going to think of with immobility: skin, intestines slowing down, urinary tract slowing down. So I'll talk a little bit about that as we go forward. The musculoskeletal effects: inactive muscle, we're going to lose strength. Muscles are going to atrophy, which again is a cellular term for muscle shrinks. The muscle cells are shrinking. Bed rest leads to basically just loss of that muscle strength, and inactive muscles make it hard for someone to correct their position in bed. That's why we have to, people with paraplegia or quadriplegia, we have to turn them or move them or help them move, and they have to go to physical therapy and still do range of motion exercises and those sort of things, so they still don't lose some functionality and muscle tone and that sort of stuff. But also bone mass. Bone is kind of, bone and muscle are like, if you don't use it you lose it, and bone especially is based on weight bearing activities. Bone needs to kind of be stressed and have microscopic stress fractures to rebuild itself stronger. If it's never having those micro fractures and having any weight bearing activity, then tends to waste away, and that's not good for us. So activity just decreases. Um, and what they're talking about, osteoblastic and osteoclastic. Osteoblasts are the bone building cells, about building it up. That activity decreases, and osteoclasts are the bone destroyers or declutterers, and they're going to be more active without weight bearing. And so that's where bone health gets off to. So um, loss of muscle also does affect venous return. Um, so our veins are really low pressure, if you kind of remember from anatomy, and they need the help of valves in our veins and skeletal muscle pumps, basically skeletal muscle pushing on our veins to help get the blood back to the heart. And if I have loss of muscle function, then there's potential for pooling of blood in dependent areas, which would lead to edema. Um, So other musculoskeletal effects: tendons, ligaments tend to become stiff. They require movement to maintain their functionality. And so they'll shorten and stiffen up, and they get really dense if they're not utilized. And this just decreases range of motion. This is where you get things like contractures and that sort of stuff, not just dependent on tendons and ligaments becoming shorter and more denser, but a combination of the musculoskeletal changes and the bone changes and the tendon ligament changes are going to can lead to contractures. And what contractures are is where you've probably seen it in a hospital setting. This is where someone would leave their arm in one position for a long time, or like that position, and their arm kind of gets stuck there and you can't unbend their arm or elbow, so to speak. So, cutaneous effects. This is section is just mainly talking about skin breakdown. That is kind of the big three. That's one of the huge things with immobility is skin breakdown. So it has to do with that gravity force. But again, with immobility, circulation is generally impaired, and therefore lacking nutrients, oxygen to cells. Cells regeneration ability and metabolism is reduced. And so therefore healing is reduced, and uh, some of the areas that are going to be prone to effects are going to be areas that have more pressure based on gravitational force, like someone laying supine or laying down. So the right atop the buttocks, or lack of a better term, the butt crack, the sacrum area is a high pressure area, to where you sit or lay. Your heels The hips and elbows are all high pressure points against usually bony prominences. So the bone is kind of right underneath the skin there, and that leads to lacking blood flow, and it can lead to cutaneous ulcers or other skin breakdown. And along with that too, loss of sensation. If you notice too, like sensation is a huge factor in this too, because if you're laying in bed, right, you get a little bit uncomfortable, you kind of turn over. Well, if I'm paraplegic, then I don't have that same indication to turn over if my butt's numb because I can't feel it anyway. And so then I don't turn, or I don't move myself in bed. I don't have that same feeling, and that can lead to prolonged static positioning. And then other factors would be excessive moisture and poor hygiene. Like if someone's urinary incontinence, they're sitting in their own urine. That's acidic. Um, and the acid of urine will break down skin faster than not. And then, along with just in general, maybe poor nutrition is a factor as well. So, that's the factors with the skin. Cardiovascular effects. We talked about these a little bit, but blood pooling in places because we don't have efficient venous return. This could be fully, immobilized or prolonged immobility. Could lead to blood pressure drops when you change positions. That's what orthostatic hypotension is. Hypotension means low blood pressure. Orthostatic means when I change positions. And that could lead to fainting, feeling like they're gonna faint. Their color goes away. That's pallor, sweating, dizziness, rapid pulse. Uh, so it may take a long time after a long period of bed rest for the cardiovascular effects to kind of take back control. And then again, edema and blood pooling is going to cause uh, pressure in the capillaries. Also, is a very high risk for leading to blood clots or thrombus um, in the deep vein legs because of the immobility. Um, and just because of the venous flow sluggish and the higher capillary pressure and the fluid, this is all potential for a lot of problems as far as cardiovascular goes. Respiratory wise, there's definitely going to be decreased metabolism, those sort of things. um, Respirations get slower and more shallow. That can be worse with their certain pain medications and drugs. And lungs tend to secrete more if they're not being like actively used more. Digestive, again, the big three: digestion, urinary problems, and then a lot of the cardiovascular effects of immobility. But people that are immobile are always going to have urinary problems more than likely and digestive problems. So they're having less appetite, constipations, sluggish, and then urinary is just generally the stasis of urine. So retention. Retention means to retain. So retention of urine in the kidneys and bladder. This could make people more at risk for urinary tract infections, kidney stones. Typically, people that are immobile have reduction in some hormone production. Particularly, the book highlights too that they have reduction in ADH, which is anti-diuretic hormone that kind of keeps us from losing too much urine. There, where they would have a lot of urine, and that could lead to dehydration, among other things. So it's kind of a mixed effect. So some questions for us to answer. What is hemiplegia? I'll give you a second to answer that one. Okay, correct answer is paralysis of one side of the body. So blood pooling, increased capillary pressure, and edema can promote what in veins, especially in deep veins. So this is kind of in the answer, but thrombus formation. So this not only leads to edema would be correct, but one risk is a clot forming, which then can move, and that would become an embolus. Common digestive system effect of immobility, is blank due to decreased dietary intake. You could probably guess this one. Constipation. What is orthostatic hypotension? I kind of mentioned this, but this could be a result of, again, immobility, blood pooling, not enough venous return. I'll let you pause it. All right, correct answer is dizziness upon changing position. Orthostatic means the change in position part. Hypotension is a low or drop in blood pressure. What's respiratory effects of associated with immobility? Okay, let you pause it. Correct answer is number 4. Decrease metabolism, shallow breathing. Also, increased mucus production would be tied into there. Primary effect of prolonged bed rest on muscles. All right, I'll let you pause it. Correct answer is loss of strength, endurance, and mass. All right, finally, to round it out, what's a consequence of immobility on tendons and ligaments? Okay, after pausing it, so let me know what you think. It is shorten and lose flexibility. So this one could get you too, because they say they increase in density, which they do without shortening, but they do shorten. They remain unchanged. No. They become stronger and more flexible. No, that wouldn't make sense. Just like muscle, bone, anything else in that family, you have to kind of stretch it and use it. So they shorten, lose flexibility, and become more dense. Okay. So that is a summary of chapter 25. Uh, the factors that are around and environmental factors around immobility. So thank you.